Well, the AMA convened the Task Force to Reduce Opioid Abuse in 2014, and we were deliberate about setting metrics regarding our recommendations. One of our first recommendations was to encourage physicians to register for and use their PDMPs, and physicians have certainly answered that call. The number of queries went from 60 million to approximately 130 million in just 2 years. So physicians are using their PDMPs when they are user-friendly, when they have real-time actionable data. There's no question that physicians see PDMPs as an important tool. And I just want to emphasize the use increased in states without a mandate as well as those with a mandate. Well, we have to always keep in mind the context of this epidemic and that our solutions are not sort of panaceas. So the PDMP should be used and viewed as a tool and not a panacea. PDMPs don't treat patients. And so once I, as a physician, check the PDMP and perhaps I learn that one of my patients has received prescriptions for multiple doctors, it's the then what that's important. If I find out that my patient has a substance use disorder, I need to make sure that that patient has access to treatment. So it's the then what. Now that I have that data, that's critical. It's necessary but not sufficient. So we have to make sure that treatment is available for those who need it. Well, certainly the AMA and America's physicians are in this for the long run. We have our 6 recommendations. Our last recommendation just came out regarding storage and disposal of unwanted medications. And again, it's important, and the AMA will continue to be a partner. This is an all-in proposition, and so the AMA is there, America's physicians are there, but it certainly is going to continue to take our legislators and our policymakers to, again, continue to develop policy, but more importantly, make sure that folks have access to treatment. As I mentioned, the number of prescriptions are going down, so that's a good thing, but that's not enough because the overdose deaths are still increasing. And I believe that a significant factor is lack of access to treatment. And so the AMA will continue to focus on the need for treatment for those with substance use disorders. And we hope that all of our partners, all of the stakeholders, from policymakers to legislators to the health insurance plans, ensure that there is access to treatment.